people as they age tend to be treated very compassionately and also more lovably sometimes by healthcare providers. So I think sometimes opioid prescribing can be more liberal toward seniors and older people whose bodies have changed and abilities to metabolize have changed over the course of their lifetimes. So I think we've had patients on our treatment programs in their 70s who have indeed opioid addiction issues. And those patients greatly benefit from help. So I think providers need to be very judicious about prescribing opioids in the elderly who are at more risk of falls, having lightheaded episodes, having comorbid health issues. So yes, I think we need to be very prudent with prescribing for these lovely people because they are at very great risk of having negative consequences from opioid prescribing. And I think it does happen too much that these people, because they are perceived as being more vulnerable, may often be more likely to get an opioid prescription because how could such a person have an addiction issue or have a potential to misuse something that we will prescribe them to try to help them? So I think we need to be judicious and very cognizant of the fact that all people, upon short exposure to opioids, have a risk of developing a problem with opioids. And older people may well be less able to tolerate the effects of them because of bodily changes that occur through a lifetime. The disease of addiction as we see it, or the likelihood of misuse or problems with the substance occurring, are non-discriminatory in their ability to take place. People who do not look like what one might prejudicially identify as a potential addict have every bit as much of an opportunity or chance to develop a problem with the substance. So we need to stop in being victims of our ability to judge based on someone's appearance, but can try our hardest to be careful about what we provide people as a treatment, because all people are at risk of developing problems with these substances, all medications, but particularly opioids. I think there's a lot of people have a preconceived notion of what an addict is. And in fact, we probably all know somebody, without knowing it, who's on Suboxone or methadone for addiction treatment. It can be your car mechanic, it could be your home renovator, it might be your nurse, your engineer, the architect who's designing your new house, someone in the bank. When I go to do various errands within the city, when I do banking, for example, some might ask, well, I see you're a physician. What type of work do you do? I will answer that question and tell them that I work in primary care, but primarily doing addiction medical work. Oh, I have a friend who's on methadone. I think he saw you before. Maybe he did or maybe he didn't. Or I know someone else. Almost everyone knows someone who's been affected by substance use issues. And of course, opioids are one of the biggest problems we face right now.